Hi, and welcome to my whole body massage course. In this session, I want to take you through something that's very important. Something you really need to understand before you start massaging. And that is known as the contraindications, or when you shouldn't massage. I remember when I first started in massage as a sports trainer, the very first event that I massaged at was an Australian rules football game. And at half time, a player came in who had been kneed severely in the back. He came over to me and said, "Brian, can you put some heat rub on?" And I proceeded to get the heat rub. Lucky for me, there was an experienced trainer with his eye on me. Brian, no heat rub. With something that's going to bruise, you need ice. So it really is important to understand the contraindications. Our role as massage therapists is not to hurt somebody, but to make them feel better. So you have your list there. I suggest you print those off and look at them often until they become second nature. So let's just go through them. The first one is abnormal body temperature. If someone comes in with a temperature, the massage will probably increase that temperature, so it's not advisable to give them a massage. The second one on your list is allergies or skin conditions. If someone comes with an allergy, they will probably tell you in the interview stage, and they'll be able to advise you whether they can be massaged or not. Sometimes people come and they're not aware. When they're face down, they can't see their back, so they've got all these skin rashes and things on their back. It's quite okay to ask them if they're aware of those allergies. If they aren't, and it looks red and nasty, I would suggest that you do not massage it. If they say it's okay to be massaged, but you look at it and think, "Oh, I really don't want to touch that," well then I would say, "Look, I think tonight it looks a bit inflamed. I'm not going to massage it." The other thing too is any skin conditions that they may spread, so the massage may spread that condition further. So my suggestion is check with them, and then if you're not comfortable, let them know it's inflamed. I'm not going to massage you tonight in that area because it looks all red and nasty, and they should accept that. Okay, the third one. Any illness or disease that you are not familiar with. Once again, at the interview stage, if they share an illness or a condition that you're not familiar with, obviously they should know all about it. And if they're not sure whether they can be massaged or not, and you kind of think there's some warning signs there, I would first get them to check with their doctor before proceeding with your massage. Just got to use wisdom at all times. As I said before, our aim is to help them, not to make them worse. The next one, any injury involving bleeding or bruising. There's no massage for the first 48 hours. They should have rest, ice, compression and elevation. Often named the RICE treatment from the first 4 letters. That's rest, ice, compression and elevation. And if someone rings you up wanting to book a massage and they say they've had a nasty fall or an accident, I would ask them how long ago. And if it was recent, that's what I'd be suggesting to them before they came to see you for massage. Massage will increase the bleeding, make the injury worse. So we don't want to do that, do we? Okay, let's go on to the next one. Blood pressure. Blood pressure is an important one. If someone has a history of blood pressure, often the massage will help. If it's stress and stress related, the massage will actually help reduce that stress and also help them with their blood pressure. There may be times too, especially when at the end of the massage, when they go to hop off the table, if they sit up too quickly, their blood pressure may drop and they may feel a bit dizzy and wonky. So always advise the person you're massaging to sit up slowly, and if they feel a bit dizzy because of the drop in blood pressure, just to sit on the table for a while before they hop off. This is quite common and you'll come across it, so just be aware of that one as well. The next one is broken skin. Any area with broken skin, of course, if you're massaging over it, it may lead to infection. Another thing you'll come across is people with pimples that may look like they're ready to break loose. So I would avoid those as well, because if they have an emission from that pimple, that wound's going to be open, and often by massaging over a heady pimple, this will happen. So just avoid those as well. Next one, cancer. Now there's a lot of different discussions concerning cancer. Some say that massage should not be done. Others say massage is beneficial. And in my experience, if you're not sure, I would get them to ask their oncologist or their doctor. But if the cancer is terminal and massage is contraindicated, often the person won't mind. And they would want the relaxation benefit of the massage. And I give an example there of a lady, a 19-year-old, she was just riddled with cancer. When she first came to me for massage, her life expectancy was around about 6 months, maybe longer if she was lucky. She came regular for massage, and I can tell you it was just an honour and a privilege to offer that feeling of relaxation for her. And actually she lived for another 18 months, which was amazing. So for 18 months I massaged her regularly, and as I said, it was just a real honour and a privilege to be a part of that part of her life and offer that comfort. The other cancer you need to be aware of is lymphatic cancer, because that can metastasize, so that's often contraindicated as well. So if you're not sure, check with the oncologist and their doctor. But as I said before, often the patient will say, I don't care what they say, I just want that feeling of relaxation. And as long as you've got their permission and authority, you might get them to sign something if you're a bit doubtful, to say that they've given you the okay, just to protect yourself. But then you can proceed and offer that comfort, as I've already shared. The next one is diabetes. And massage for people with diabetes is fine, apart from two things you need to keep in mind. Often with the massage, the blood sugar level will drop. So you need to make sure that they have their something sweet or something to take to help with that at the end of the massage if needed. And secondly, if they've got peripheral nerve pain, well then massage, or deep massage, is certainly contraindicated, because you can't go deep, they can't feel it, so you need to be very aware of that and very careful of that one as well. So trust as you go through, you're gonna learn these so they become second nature. Let us continue now. Heart problems, and this depends on the problem. If the client has a chronic problem, a weakened heart or weakened valves, massage may be contraindicated, because you're going to put some extra pressure on the heart, and that's not recommended. The other thing to be aware of is pacemakers. Someone will come with a pacemaker, and they're getting smaller and smaller these days, but I've massaged people with pacemakers, usually up here on the shoulder. You just massage around the area and just be aware of that and be very careful of that. Hepatitis, massage is definitely to be avoided with hepatitis, especially for the types that are highly contagious. So just be aware of that one. I have massaged someone with hepatitis that wasn't at a contagious stage. I just went very casually and very gently, but it's your choice whether you do or you don't. Infectious disease, of course, you need to avoid that, because you don't want to catch any of their infections, and you don't want to cause that infection to spread. The other thing that we're going to move on to now is inflammation. As you know, the body uses inflammation as part of healing. And what I find with inflammation, an ice massage can be helpful. When I had my clinic, sometimes I'd go up into the kitchen and get some ice blocks. Sometimes at the end of the massage, I've massaged around the area, not on the inflamed area. And then to finish the massage off, with their permission, of course, I just get an ice block and run it direct. You can run it directly on the skin, providing you keep it moving, because the ice actually melts. You wouldn't leave the ice directly on the skin and leave it there, because it would adhere to the skin. But if you keep it moving, and as the ice melts, it offers that, it helps with the inflammation. So that's a good one to know. The next one, intoxication. That's a good one. Now, you as a massage therapist, you don't want to be intoxicated, all right? It's not very good for your reputation, okay? And you don't want the smell of alcohol in your breath either. But seriously, if someone comes who's intoxicated, intoxication numbs their senses. So they can hop on the table and they're going, yeah, go deeper. Yeah, I can't feel it. Great, go in deeper. And then the next day they wake up and they can't move. So avoid massaging people with intoxication because they can't give you accurate feedback, all right? And don't you dare smell of alcohol, okay? Next one is joint dysfunction. If someone comes and reports of, their shoulder dislocates, their kneecap or any joint dislocates easily, well then you need to be very, very careful around that area because you don't want to cause any dislocation. So it's just common sense and care, all right, at all times. Okay, we're nearly there. You're doing really well. Next one is neuropathy. Now, neuropathy it numbs the sense of their nerve sense. They've got no feeling. So once again, you can't get accurate feedback. So if someone's suffering from neuropathy, it's just a gentle massage only. No deep work because they can't relate back to you how it's feeling. They haven't got any feeling there. Okay, so just be careful with that one. The next one is osteoporosis. And this is mainly in the elderly. This is where the bones become weak. So you need to be really aware of that and not massage too deeply because it's easy to fracture their bones. And that's why I said at the start, you need to be aware of these contraindications because sometimes it's in a young person as well. Or what happens if your grandma says, can you come and massage my best friend? And you go over there and you're not aware of the contraindications and you just lean too heavily and you break her ribs. How are you going to feel? Okay, so just be aware of these again. Mainly in the elderly, but that does happen in younger people as well. So just be aware of that and only massage lightly. Pain, discomfort or numbness. If it's undiagnosed and you're not aware of it, then maybe you need to send them off and get it diagnosed accurately. And also, you just need to be careful around that. If they do know, look, I've got something trapped there, you massage around the area. More advanced therapists might be able to help with it. But in your early stages, just once again, care and concern with that one. Recent fractures. Recent fractures, it's okay to massage away from the fracture until the fracture is fully healed. Even when they're out of plaster or off their crutches or whatever it may be where they've broken those bones, you need to be very, very careful over the fracture itself. And I would just go very lightly. In fact, I'd avoid it and massage around until they get the okay and the clear that it's fully healed. It does take some time for those bones to regain that strength again. So just be very careful with recent fractures. Next one is recent injury or surgery. Sometimes massage is recommended after surgery, but you would only do that under the surgeon or doctor's directions and do it exactly as they say. You need to understand the body's natural response too is inflammation. So there'll be some inflammation there, and the RICE method can be applied. That's the rest, ice, compression and elevation, or the ice massage. But as I said before, sometimes the doctor might suggest some massage to get rid of that excess fluid after an operation, but only under their instructions. Rheumatism, that's contraindicated in the really acute stages. Otherwise, you can massage very gently. Sometimes around the joint, you're able to massage some of the swelling out, but once again, very gently. Proceed cautiously at your stage of massage, unless you're an advanced therapist that knows what they're doing. I would just massage very, very gently with that, but it can help around the joints as you try and gently massage the swelling out. So just be careful with that one as well. Some medications, especially the blood thinning medications, you need to be aware of those because they bruise very easily. So if you're going to start working on a knot or do something that you think you might have a go at, you need to be very, very careful. You're going to cause a lot of bruising. So just be careful. Find out what medications they're on. Find out what reactions they can have. And if you're not sure, once again, get them to check with their surgeon or their doctor before you proceed. Common sense and caution. Protect yourself at all times. systemic infections, and I think, that's just common sense, we don't want to spread the infection, so massage is definitely contraindicated. Varicose veins. Now here's a good one. You're going to come across a lot of those if you're going to start massaging. And my golden rule of thumb is the bigger they are, the less deep you go. So spider veins are usually okay to massage, but as they become larger, you go gentler. So the bigger they are, the gentler you go. Okay, and I think if you stick with that rule, you can't go wrong. So just be aware of that with the varicose veins. Whiplash. Whiplash is a really serious one. Now this is one that takes a lot of care. Whiplash has been found, people have had x-rays and they've been cleared and they're found to have some hairline fractures that didn't show up in the x-rays. So for me, when someone comes that's had whiplash, I need to find out the seriousness of it. Did their head go backwards and forwards 4 or 5 times? Was it a major collision, or did they just get bumped heavily on a sporting field? How bad was the whiplash? Is there a possibility of some fractures there? And if there's a possibility of some fractures there, even though they've been x-rayed and scanned and cleared, proceed very, very, very cautiously. Okay? That's the last one, but it's one of the most serious ones. So there's probably others as well, but these are the main ones you'll come across. So as I said, before you start massaging, make sure you have a clear understanding of the contraindications and you will not get yourself into trouble. I know you're going to do well. God bless.